Ever wondered how and why we use vasopressors and inotropes in ICU and ED? Well, you're about to dive into the world of these powerful medicines, so buckle up. Vasopressors and inotropes may sound like complex terms, but don't fret. In simple terms, they're drugs used to regulate blood pressure and heart function. They're like superheroes, swooping in to save the day when our bodies are facing severe health crises. Let's break it down. Vasopressors and inotropes are primarily used in intensive care units, ICU, and emergency departments, ED. Their main job? To stabilize patients who are critically ill and whose bodies are struggling to maintain blood pressure and heart function. But how exactly do they work? Imagine you're driving a car. Vasopressors are like the gas pedal, accelerating the heart to pump blood more forcefully. They constrict the blood vessels, increasing blood pressure, which helps to ensure essential organs get the oxygen and nutrients they need. On the other hand, inotropes are like the gear shift. They change the speed and force at which the heart contracts, which can increase or decrease the heart's pumping action, depending on the situation. Vasopressors and inotropes are vital tools in the medical field. When a patient's life hangs in the balance, these drugs can tip the scales towards recovery. They help to maintain the flow of life-giving blood to the brain, heart, and other vital organs, providing a lifeline in critical situations. However, as with any medication, vasopressors and inotropes are not without their risks and side effects. It's a delicate balancing act to ensure the patient is receiving the right amount of these drugs to help, not harm. So, there you have it, a brief introduction to the world of vasopressors and inotropes. They might not be everyday household names, but in the world of emergency medicine and intensive care, they're nothing short of lifesavers. If you're curious to know more about vasopressors and inotropes, stay tuned. It's a fascinating journey, and we're just getting started. So how do vasopressors work in our body? Well, let's delve right into it. Vasopressors, as their name suggests, press or constrict the walls of our blood vessels, effectively narrowing their diameter. This process is known as vasoconstriction. Imagine a garden hose. When you squeeze the hose, you're reducing the space the water has to flow through. The same pressure at the tap will now push the water out faster and with more force. This is similar to how vasopressors work in our bodies. They increase the force or pressure of the blood flowing through our vessels, making the heart work a little harder, but ensuring that blood reaches all the critical organs efficiently. Vasopressors exert their action by binding to receptors on the smooth muscle cells that line our blood vessels. These receptors are known as adrenergic receptors, and they respond to adrenaline, or epinephrine as it's often called. When a vasopressor molecule binds to an adrenergic receptor, it triggers a cascade of events inside the cell that leads to muscle contraction. The contraction of these smooth muscle cells causes the blood vessel to constrict, reducing its diameter. This reduction in vessel diameter increases the resistance to blood flow, which in turn raises the blood pressure. Now you may wonder, why do we need to increase blood pressure? Well, blood pressure is crucial for ensuring that blood, carrying life-sustaining oxygen and nutrients, reaches all parts of our body. When blood pressure drops too low, such as in shock or severe dehydration, it can lead to organ failure and other serious complications. Vasopressors are like the superheroes of our circulatory system. When the body is in distress and needs a little extra help maintaining blood pressure, vasopressors are there to save the day. Remember, though, that these are potent medications and should only be used under the guidance of a healthcare professional. They're a valuable tool in the medical toolbox, but like all tools, they need to be used appropriately. Vasopressors, therefore, play a critical role in maintaining blood pressure. But when exactly do we use vasopressors in ICU and ED? Well, for starters, vasopressors are employed in critical care settings to counteract life-threatening low blood pressure, often seen in conditions like septic shock or cardiac arrest. These conditions can lead to a drastic drop in blood pressure, causing vital organs like the heart and brain to be deprived of the necessary blood flow they need to function effectively. In the case of septic shock, this condition occurs when an infection leads to a significant drop in blood pressure. This is where vasopressors come in. They constrict the blood vessels, thereby increasing the blood pressure and ensuring that the blood flow to these vital organs is maintained. When it comes to cardiac arrest, the heart stops pumping blood, leading to a critical drop in blood pressure. Again, vasopressors play a crucial role. They help to increase the blood pressure, giving the medical team time to address the underlying cause of the cardiac arrest and hopefully restart the heart. Vasopressors are also used in the management of certain drug overdoses. Some drugs can lead to a significant drop in blood pressure, and vasopressors can help counteract this effect, keeping the patient stable while the body processes and eliminates the drug. It's important to remember that the use of vasopressors is a delicate balancing act. They need to be used judiciously, as their overuse can lead to harmful side effects such as tissue damage due to reduced blood flow. This is why they're typically administered under the close supervision of a healthcare professional in a critical care setting like an ICU or an ED. So, whether it's a patient in septic shock, a person experiencing cardiac arrest, or an individual dealing with a drug overdose, vasopressors are often the go-to solution to quickly and effectively increase blood pressure and maintain blood flow to vital organs. Vasopressors are hence vital life-saving medications in ICU and ED. They are integral to the management of critically ill patients, and their proper use can often mean the difference between life and death. Now let's switch gears and talk about inotropes. Inotropes, like the name suggests, have everything to do with inotropy, a term that refers to the force of muscle contraction. In the context of the heart, inotropes are drugs that can increase or decrease the force of your heart's contractions. But for today, we're focusing on those that increase the force-positive inotropes. Let's imagine the heart as a pump. Now, if this pump isn't strong enough to circulate blood throughout your body, it might need a bit of help, right? That's where inotropes come in. These drugs are like a personal trainer for your heart, helping it pump harder and stronger. So, how do they do this? Inotropes work by stimulating the beta-1 receptors in the heart muscle cells. These receptors are like little doors that, when opened, allow more calcium to enter the heart cells. Calcium, in turn, is the key player in the contraction of the heart muscle. Think of it as the fuel that powers each pump. By increasing the amount of calcium, inotropes make each contraction stronger, helping the heart pump more blood with each beat. Inotropes can be further divided into two main categories: those that work directly on the heart muscle cells, like dobutamine, and those that work indirectly by increasing the level of cyclic AMP, like milrinone. Both types ultimately lead to stronger heart contractions, but they just take different routes to get there. Inotropes are incredibly important in the management of certain heart conditions, especially heart failure, where the heart's pumping action is weaker than normal. By strengthening the force of the heart's contractions, inotropes help to improve blood flow, ensuring that the body's organs get the oxygen and nutrients they need to function properly. So to wrap it up, inotropes are like power boosters for your heart. They work by stimulating the heart muscle cells to contract more forcefully, ensuring that your heart is pumping blood efficiently throughout your body. Inotropes, therefore, are key in enhancing heart function. So, under what circumstances do we use inotropes in ICU and ED? Inotropes are potent medications with the power to alter the force of your heart's contractions. They're often the go-to choice in intensive care units and emergency departments when a patient's heart is struggling to pump blood efficiently, such as during heart failure or cardiogenic shock. Let's delve into these conditions a bit more. Heart failure is a chronic condition where the heart muscle is unable to pump enough blood to meet the body's needs for blood and oxygen. It's like your heart is running a marathon, but it's barely making it past the starting line. Inotropes can help give that extra push, strengthening the heart's contractions and improving blood flow. Similarly, in cardiogenic shock, the heart can't pump enough blood to your body due to damage from a severe heart attack or another heart condition. It's a dire situation, like your car engine failing in the middle of a busy highway. Inotropes, in this case, can act like a jump start, boosting the heart's pumping capacity and ensuring vital organs get the blood they need. However, it's important to remember that inotropes aren't a one-size-fits-all solution. The decision to use them depends on the individual patient's condition, their overall health, and the underlying cause of their heart problem. It's a delicate balance, a sort of medical tightrope walk that healthcare providers must navigate. Inotropes are also used in combination with other treatments. For instance, they might be paired with vasopressors to raise a patient's blood pressure, or with diuretics to reduce fluid buildup. This synergistic approach can maximize the benefits and minimize potential side effects. It's also worth noting that inotropes aren't just for emergencies. They may be used long-term in some patients with advanced heart failure as part of their ongoing treatment plan. In the fast-paced realms of the ICU and ED, every second counts. When a patient's heart is failing, inotropes can provide vital support, helping to restore blood flow and buy precious time. Inotropes, thus, are crucial in managing heart-related complications. Like all medications, vasopressors and inotropes also come with their share of risks and side effects. As life-saving as they are, it's crucial to consider these factors before administration. Vasopressors, in particular, are potent substances. They constrict blood vessels, increasing blood pressure. But this constriction isn't limited to specific areas, it happens throughout the body. This can lead to reduced blood flow to the extremities, resulting in tissue damage or even necrosis in severe cases. There's also the risk of arrhythmias, abnormal heart rhythms, as these drugs can overstimulate the heart. Vasopressors can also cause hyperglycemia, an excess of glucose in the bloodstream, which can complicate matters for diabetic patients or even induce diabetes in predisposed individuals. Turning to inotropes, these medications can increase the force of heart contractions, improving blood flow. However, they can also put excess strain on the heart. Over time, this might lead to myocardial ischemia, a condition where the heart muscle doesn't get enough blood. This can cause chest pain and, in severe cases, a heart attack. Moreover, inotropes can cause arrhythmias much like vasopressors. And let's not forget the risk of hypotension or low blood pressure, a dangerous side effect that can lead to fainting, dizziness, and in extreme cases, shock. It's also worth mentioning that both vasopressors and inotropes can lead to an imbalance in electrolytes, the minerals that help regulate nerve and muscle function, among other things. This could result in muscle weakness, twitching, or even seizures. Indeed, the risks and side effects of these drugs are not to be taken lightly. But remember, they are used in critical situations where the potential benefits often outweigh the risks. These powerful tools can mean the difference between life and death in the ICU or ED. It's important to weigh the benefits against these potential risks when administering these medications. With careful monitoring and judicious use, these medications can save lives, even in the most dire circumstances. It's been quite a journey understanding vasopressors and inotropes, hasn't it? Let's take a moment to recap what we've learned today. We started off by introducing vasopressors and inotropes, two powerful classes of drugs that can make a significant difference in the treatment of critically ill patients. We discovered that these drugs are not one and the same, but serve different yet equally important roles in the medical field. We then delved into the fascinating mechanisms of vasopressors, drugs that essentially constrict blood vessels to increase blood pressure, ensuring that vital organs receive enough oxygen. These lifesavers are particularly useful in situations like shock, where the body's normal mechanisms struggle to maintain adequate blood pressure. Next, we turned our attention to inotropes, drugs that strengthen the heart's contractions and improve blood flow. Their role becomes vital in cases such as heart failure, where the heart is unable to pump blood effectively. We also explored their usage in the intensive care unit and emergency department. We learned that while both vasopressors and inotropes are employed in these settings, the choice of which to use depends on the patient's specific condition and needs. And of course, we didn't shy away from discussing the potential risks and side effects of these drugs. As potent as they are, vasopressors and inotropes can have adverse effects, such as arrhythmias or tissue damage if not carefully monitored. It's a delicate balance between the benefits they bring and the risks they pose, underlining the importance of careful administration and vigilant monitoring, and that brings us full circle. From understanding what vasopressors and inotropes are, to how they work when they're used and the risks they carry, we've covered a lot of ground. Remember, these drugs are tools in our medical arsenal, and like all tools, they must be used wisely and appropriately. It's our responsibility as medical practitioners to ensure they are administered in the best interest of our patients, for their well-being is the ultimate goal we strive for.